Hi, good afternoon, everyone. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. Glad you could join us today. And I hope everyone has recovered from the legislative session. It's hard to believe it was just a couple of weeks ago, and now we have real spring weather. It was so beautiful the past couple of days, and then we have like this big thunderstorm, but I'm kind of digging all of it. It's much better than that cold, dreary weather we had for the last few months. So today was going to be originally our quarterly forum with the Cabinet for Health and Family Services. We've actually rescheduled that for June 28th. And we did that because Cabinet leadership wanted some time to provide more detail on a few things, including we hope plans for implementing House Bill 7 and what that will look like, the federal public health emergency and what the status is there, and then what that means for Medicaid renewals and the timeline. So for that reason, today we're going to be doing our usual state and federal policy update, and we'll be talking about both a recap of the legislative session, what's happening, or what we anticipate for the interim, and other things that have been changing with our safety net. And as always, our goals for these webinars is for you to get the latest information on the state's response to COVID-19, to hear updates on our safety net programs and share feedback, ask questions. We really want to make sure that this is valuable information for you and for the work that you do in your communities. And for any newcomers who may be joining us for the first time, I always like to take a moment. We can advance the slide, Kelly. To talk about Thrive Kentucky. Our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for those reasons, we focus our advocacy on both anti-poverty and anti-racist policies. And you can see the shared principles that guide our work on this slide. And if we go to the next slide, you'll see the organizations that are part of Thrive Kentucky. We can go to the next slide. Also wanted to thank our 2022 Thrive Kentucky sponsors. So this slide has been filling up as the year has progressed, and we really appreciate the support of United Healthcare, Humana, Passport, Anthem, and Unite Us. And we continue to invite other organizations to sponsor our work. We will be doing these webinars monthly, and actually starting soon, we'll be doing weekly presentations in different areas of Kentucky. And I'll talk a little bit more about that near the end of the presentation today. We can go forward, Kelly, but having the support of our sponsors keeps these webinars free and also allows us to provide CEs for certified community health workers, for licensed social workers, and soon we're going to be adding CEs for some others too. So if you join us on a monthly basis and that sounds interesting to you, we'd love to hear from you. What type of certification or licensure would you have, and what people really want to get credit for. So here's the agenda that we're going to be covering today. During each of our sections, be sure to put any questions or comments that you have in the chat. We like to kind of address those as we go. We find that that works best. And if we don't have time for everything, in the 90 minutes that we have today, we'll make sure to send any follow-up in writing, answers to your questions. We also send out the chat, the slides, the recording. You'll get everything from today's meeting, probably in an email tomorrow. So just some quick housekeeping before we begin. We always have a number of folks on our webinars, so please be sure to mute your line. We are recording the webinar, like I said, and so we'll be sending that out along with other materials and an evaluation that we would love for you to complete. So watch for that in your email tomorrow. And I mentioned CEs for certified CHWs and for licensed social workers. If you'd like to receive CEUs, email Kelly, and Kelly will put her email in the chat if she hasn't already. And just want to thank again our sponsors for supporting our work. I am going to turn it over to Kara Stewart, I believe, to give us the legislative recap.
That's right, it's me. We can go ahead and go to the next slide. There's nothing on this one. So like Emily mentioned, the session is over. I'm sure everyone who is here noticed that, you know, the Twitter volume went down. That is because the legislature has sine die. Sine die means we are out of the session, and now we're in sort of the dead time, the pause until the interim begins, which usually happens in June 1st. They can start now. There's not like a rule around that. It's just generally starts in June. There is an approved meeting calendar for the interim. There's a link when you get this tomorrow. The link is there. You can go ahead and go to the legislature.ky.gov to check that out right now. Nearly, like you can see in the middle of the page, most were overridden that the governor vetoed, but there were some bills that happened at the end that were vetoed that could not be overridden. And we've got to work through of bills we've talked about here before in previous months to talk about what the final status was. The next slide. And here they are. Start with the good news bills. Of course, there was some good news in the big budget bill, House Bill 1, and that we kept all of our Medicaid funding intact. SEEK funding is the education funding for schools that was kept at the same levels, and that we did address the pension costs for quasi-governmental agencies. Those are places like the health departments and legal aid organizations and places that are in the domestic violence systems. And of course, I'm sure if anyone's watched the news, you've heard about the pay raises for state workers, including legislators, but not for teachers. So if I'm the first person reporting that to you, please get busy and tell your friends, or even if I'm not. So, and then House Bill 44 these are in green because it's a good bill that passed. That's what this code means. Good bill that we think Thrive Kentucky means this helps Kentuckians thrive, and it passed. House 44 allows for excused absence for mental health, not just physical health, recognizing that, you know, our feelings and our heart are connected to our brain, and it is all a part of our health system. You know, so, and even though some kids have parents that recognize that, not all do, and it still requires, you know, proof and appointments and all that same sort of stuff. And then the next one gets wonky because House Bill 174 did not pass. So that bill failed to become law, but plot twist, it did become law as House Floor Amendment 3 to Senate Bill 178. So just stay on that roller coaster ride for a minute. And in fact, Kentucky did pass a law so that we did extend Medicaid coverage postpartum to 12 months. So that means that when folks deliver babies, that they are eligible for Medicaid with pregnancy Medicaid rules for 12 months instead of 60 days. So that's a really great news, very reasonable, rational situation. And but so don't be confused. If you see anything out that says House Bill 174 failed, it did, but the language of House Bill 174 did not fail. It just got put into a different bill. But that's one of those moments where if you were to click on that bill and go see it, it's like, yeah, that stalled out, but it didn't. 373, that's not true for that bill. It really didn't become law. It didn't get put anywhere else. So that was the 998 number. So it's going to happen anyway, and that the federal law requires it. So it's happening, but we no longer have that state bill controlling that. 525 is an excellent bill that Kentucky Voices for Health is especially excited about, which makes community health workers, ones who are certified, eligible for Medicaid reimbursement. I hope that folks on here are thinking critically about that and what you can do in your organizations to take advantage of that. Senate Bill 8, yes, we love community health workers. Senate Bill 8 is lots of changes for State Child Abuse and Neglect Prevention Board. Please jump all over that too. There's lots of opportunity there to weigh in. And Senate Bill 102 is also positive because we're going to be understanding more about what people are doing in schools and how we can take that information to help better support students. And SJR 72 is a big, yeah, Dustin's right. There is some funding. It just wasn't in where it would have come with that bill. So it exists, it's going to exist. It's just not the way that it would have been with House Bill 373. But Senate Joint Resolution 72 means we're going to have, CHFS is going to apply for a waiver for Kentuckians with severe mental illness. That is a big deal. And there's going to be a report that comes back to the legislature. So the legislature put in a lot of new reporting requirements where the information is going to come back to them more regularly, and some's going to come directly back to the LRC. So some things that used to go to some oversight committees is now going to go directly to the LRC, and we're going to see this year what that's going to look like. But this one is exciting. These are all exciting, good bills that became law. And I'm looking forward to SJR 72 to see what that's going to look like. But of course, there's still a lot of work to be done. The devil's always in the details, like we all always say in here. That's always still true. To see what the cabinet's going to put forward to the federal government to ask for the waiver for a waiver for Kentuckians with severe mental illness. But we're going to get a report back to the legislature by August 1st. So that's going to be one step in that direction. Next slide, please. And these are the bills that Thrive Kentucky decided that these are the bills that do not help Kentuckians thrive. And so House Bill 4 passed and became law, but it revamps the unemployment insurance way in negative ways, in ways that shorten the amount of time that people can stay on unemployment in a way that prevents people from being able to potentially reach their best potential or work at their highest capacity. House Bill 7, we've talked about that at great length. We have a whole other slide about that. I think everyone here has heard us discuss that through and through. We'll talk about that in the next slide. House Bill 8 is a radical shift in how we share our resources. So we change a lot we reduce our income tax, but we reduced it in a way that is the same for those with the most resources and those for the least, which I don't think is equitable and not the smartest way for us to share our resources and be honest about how to approach what we need to do to work with each other. So, and it will down the road, especially create risk for some holes in our budget. So that's why it is now the law. It passed. Dustin's throwing some numbers out. So if anybody wants to follow along there. Did not pass House Bill 21. There was some life there. That was prohibiting mask mandates in daycares and schools. It had got legs, but did not pass. House Bill 21 did not pass. That was asking people about their vaccination status. So that was one that folks were very concerned about out of this group that we had a lot of questions about in past sessions, did not become law. Senate Bill 83. So it prohibits trans girls only from participating in women's sports, right? So I guess like that's true, transgender athletes from women's sports, because of course like trans boys wouldn't be because whatever. But just to be clear there, and as of right now, it's a certain age group specifically, so it doesn't apply to really little kids. As of right now, we only know of one trans girl that it directly applies to, but Senate Bill 83 did become law to prevent trans girls from participating in sports. And I think I'm probably going over my time. Emily came off mute.
No, Kara, I'm sorry. That's not why I came off mute. I just got a question that I thought you could answer, or maybe
Okay.
you both can, about House Bill 525 and what comes next in terms of the implementation, which I know you and I both talked about quite a bit.
Yeah. So what comes next to implementation is the door. There's a really big door open right now for all of us to weigh in on how to make that be successful. We're working really hard with the state to make sure that it's easy, or as easy as possible, for small community-based organizations to be able to participate in hiring community health workers and in getting community health workers who want to be certified and eligible for reimbursement certified. Not all are going to want to be. That's awesome. No pressure. No, I don't want anybody to do that who doesn't want to be. But for those who do, where it makes sense for their organization, we want to make sure that there's a streamlined process for figuring out ways that you can get supported to get certified so that you can make this a part of your sustainable funding stream to have Medicaid. Because the risk otherwise is, of course, that only larger institutions would be able to create and absorb this as an impact initially. And that's not going to create the results that we really need for this to create equity across the state, when you're not going to have as many organizations in tiny spots and spaces. than having the state pay the state share, and having plans in place for folks to get that certification. What you
Yeah,
wanna
I'll
add?
just add that I had a recent email exchange with Commissioner Lee. Commissioner Lee is the commissioner of Medicaid, and she is currently talking with some, experts about how to pay for this without using state fund dollars. And that's a goal that she has. It's not necessary. It's not required that we have a different kind of payment mechanism. But when Kara mentioned the state match, typically Medicaid is funded by about 30 cents on the dollar from Kentucky, pulling down about 70 cents on the dollar from the federal government. That number changes sometimes, and it's different for different Medicaid populations. But that's our traditional Medicaid, and then 90 cents on the dollar for Medicaid expansion. Whenever you combine those two, it gets closer to 20 cents on the dollar for Kentucky to pull down that federal match. But right now, that's something that the commissioner is kind of exploring. I think that we can have a role in advocating for a different payment mechanism, and really just the traditional way of having state fund dollars that pay for CHW services. And then there's the billing piece of it. What services can be billed for? What are those codes, and what does that process look like? So all of those things have to be really worked out before this can start. And one of the things that I've requested is a meeting for stakeholders to meet directly with the cabinet and with Commissioner Lee, so that we can all have a conversation about this and present kind of our thoughts about how we want this to work, and the concerns that we have, the priorities that we have. And so she said that in about a month they would schedule a meeting for stakeholders. So I will keep everybody updated on that. And
Right,
Kara, I'm sorry that I interrupted you. I think you had
No.
a couple other bills to go through.
No, that's totally fine. I mean, that's sort of, that's one where I think the folks at this meeting, we still have a lot of room to shepherd that bill through. I think it's very important that small organizations participate in what would be functional. And if you have an interest, or if you don't, or if you know another community-based organization in your community where you think, what, they might be interested, but they don't normally participate in advocacy calls, but we really need to pull them in to see what it would take for them to be able to get a connection with someone who's already billing Medicaid, so that they can get connected. Because of course, KVH will continue to have the conversations, but we want to make sure that we're bringing the right people to the table and the right direct, first person lived experience voices, to know that we're asking the right questions. Because we want House Bill 525 and community health workers to be a success in a meaningful way. We want it to be anti-racist. We want it to be equitable across the board. We want it to have an impact on people's lives. So that's big. It's a great bill. So, and I'm hopeful for it. The other one that we hadn't touched on from this list did not pass 739, which allowed some lawsuits against UCBS social workers. I'm very glad that did not pass. I think it would have been challenged in court otherwise anyway. We also did pass the anti-SLAPP, which was sort of also would have been in massive conflict. Like, we're now passing anti-SLAPP, so you can't sue people for defamation just to tie them up and use the courts as a tool. And then we're going to allow you to use the courts as a tool. That would have been a mess. And then we did pass Senate Bill 138, which limits instruction in Kentucky middle and high schools on race, religion, and history, which I'm sure you all know kind of what that was described as. It was called, people referred to it as the anti-CRT bill.
Oh,
It
no.
was not any of the, it wasn't the ones that were, what to say? The more extreme. It wasn't the more extreme sort of one, but it did pass and become law. Kristen, did you have something you want to pop in with? Take that as a no. Some people know a lot more about Senate Bill 138 than I do, so I'm happy if you know more about it and want to share and pop in than I do. Wait a second, we got to go to our Senate House Bill 7. Where is it? There we go. So House Bill 7, I promised you a whole slide, and here it is. House Bill 7 was a big bill addressing a lot of the safety net benefits that we talk about, or safety net survival things that we talk about in Thrive Kentucky, like what Kentuckians need to thrive. Well, first they need to survive. And what do you need to survive? You need food, you need housing, you need healthcare, you need education, these sort of basic bottom of the pyramid elements. And that's what House Bill 7 changed and addressed. And initially, all of the Thrive Kentucky member organizations were very concerned about House Bill 7. And here's some of the changes that are now true. So broad-based categorical eligibility and SNAP change reporting was left unchanged. So what that means now is kids can still, because they're eligible, or we believe them to be eligible, they can be enrolled automatically with their school, and we don't have to have people individually applying. That was a big deal and really prevented a lot of red tape. So if that had been changed, which was in the original draft, it would have created an enormous amount of red tape for children and for schools across Kentucky. So I'm incredibly grateful for everyone who worked hard and lifted up their voice against removing broad-based categorical eligibility, even if it's an unfriendly set of words to come out of your mouth. Thank you for working it through. And if you got down with the acronym level of it, thank you for that too. Appreciate your investment. And then we also put back in the impossibility waiver, and by we, I mean all of us and everyone in Kentucky who reached out to legislators and those legislators. I also like loud thank yous to the legislators who agreed to put back in the impossibility waiver. And it's called that because the federal government has these waivers where you're allowed to waive the SNAP ABOD requirement, which is the able-bodied adult work requirement, if it's impossible to meet it because there aren't enough jobs in your county. And the original version of House Bill 7 said, no, you're not allowed to use the impossibility waiver, which I think at first blush is pretty clear that, well, if the federal government thinks it's impossible, perhaps it is impossible. And so you should take advantage of that waiver. And so that got changed also in the bill. And so I'm grateful to the legislators who understood that, who made those changes, and to all of the advocates and all of the Kentuckians who raised their voices to point that out. And then we made more accurate income reporting by requiring looking at fluctuating income to ensure more accurate eligibility determinations. In House Bill 7 for a while, even after it got through the House, it said you could only look at the most recent income. Well, most recent income is not accurate for lots of people, so many people. Lots of people's income changes. So if you're only looking at the most recent, you could be giving people Medicaid who made a lot of money a month ago, or people who made none for the last 6 months and just made a lot this last week. You're creating a lot of red tape and a lot of bureaucratic administration and reprocessing that doesn't need to happen. So I'm really grateful that we got that change in. It creates greater accuracy, which I appreciate. It also creates more honesty amongst the program and who's enrolled in it, and prevents waste and churn, because you're going to be able to tell people this is the real situation, folks. So let's be honest about it. And that makes more sense to me, to be able to be honest. And then of course, huge deal. The House Bill 7 initially set CHFS up to, I would say, fail with 60 days to complete the redeterminations during COVID. So during COVID, redeterminations were put on pause. And even though we've done a lot of them, most of them we've still done, because you can do them ex parte, because you can just check these sources, and you can say, oh, this also matches up, so it's probably still fine. But there's, quite a few folks where you're well, this source doesn't still say this, and maybe this doesn't quite match. And it was way too many to be able to do in 60 days. So now CHFS will still essentially have the same amount of time that the federal government told them they had, 12 months, to complete all of those Medicaid redeterminations, to make sure that the folks who need to stay on Medicaid stay on Medicaid. Those who don't. They have a chance to get communications out to them to make sure if they need to buy a qualified health plan on the marketplace, they can, and otherwise do what they need to do. So I'm again grateful for that. That was a major improvement. And of course, the hospitals are not going to be subject to the penalties that were originally included for presumptive eligibility. Hospitals have been doing been using presumptive eligibility in Kentucky for a very long time. So I was shocked to see that in there, other than just this is something that you could take back out, which may have been why I was in there. I don't know. You can't get into the minds of the folks putting that out there. And now the community engagement program is going to be a voluntary program. And we like voluntary programs because if people want to participate, there's something they can participate in. Okay. As long as it's not tied to eligibility, because we've seen what happens. Whereas in the case, nobody knows this, in Arkansas, when there was a required program, 25% of the people who were completely eligible and met all of the requirements of the community eligibility program, met the requirements, were working. 25% of them lost their coverage because they couldn't prove, some of them because they were busy working, that they were working and meeting all of the requirements. So I do not want to live in a place where we are punishing people for working, which is exactly what adding all of that extra paperwork does. Yeah, so only 400 ever really reported work hours, even though we know they're working because we're getting proof of it from their employers. We're getting it from their wages being reported. We're getting it, from the IRS. We're getting it from Work Number. We're getting it from so many sources that we know they're going to work. So it was just sort of dumbfounding that because they couldn't get through these other systems to be on hold long enough to report it, people are being punished. So I'm grateful that Kentucky did not go down that path, despite the fact that we opened that door and started down that path, and our House did pass that. Never mind, take that back. Reverse, redo, Kara's first redo. It was filed that way. I'm not going to put passage on anybody there. And then we're going to keep moving forward on what can be done that isn't wasteful on single EBT card, because everybody's like, yeah, that's a good idea. Unfortunately, good ideas can't always be paid for, and oftentimes create extra hassle for families, even though it seems like it shouldn't. Now I'm certain that I'm over my time, and I apologize for that. But you all, we don't do that again until January. What about that?
Even though you're over your time, which I don't think you technically are, but I feel compelled to mention two other things that we didn't put on the slide.
Well, that's not my fault though, is it? If you do
no,
that,
it's not. I'll take full responsibility for this. But one is that there are some very concerning penalties that did pass in the bill. One is a ban across programs for 5 years, just stricter and more serious penalties. We question whether the legality of these, and there may or may not be litigation, but right now just know that there are some penalties, and we're going to get more information about exactly how those will be enforced. And then one new penalty, entirely new, that only made it into the final version of the bill, which was a surprise to us, was a $500 fine for someone who is essentially self-attesting and provides information that is knowingly false. But how you would determine that they knew that information was false, I think is a concern of mine. And I think that would happen most frequently during presumptive eligibility applications. And often if you're in a facility like a hospital or long-term care and somebody else is helping you, whose responsibility is it for that information to be accurate? There are lots of questions there. It's something we're concerned about, and we're going to be monitoring pretty closely. And then there will be a task force, we think, over the interim on the benefits cliff, excuse me. So just a few other things. Sorry, Kara.
What? Why are you sorry? That's good. Yeah, there are some other things. I was over feeling really down about it, so I left those out. I apologize. There's still other. Well, also it's based on a myth, and you can't fix a bill that is based on a myth. So you can take a lot of bad things out that cost a lot, but you can't actually make it good, unfortunately. But if anyone wants to talk offline or online, public or private, about that, I'm happy to. And I don't know if this is me or not, but since there hasn't been a new slide with a new name, I'm going to say it, that there is an election this year, like every year, thanks Katie, and that all 100 Kentucky House seats are on the ballot. So everybody here that's in Kentucky, you have someone in the General Assembly that you can vote for, and half of the Senate seats are on the ballot. So, big day, big deal. And that primary election is, or primary day, is it an election? Is May 17th. I always forget the technicalities on that, if it's an election or not, or if that even really matters. But there's new districts. Check it out. Make sure you know where you're voting, as always, because even when you think you do, sometimes you don't. I have personally, despite not having moved, gone to the wrong polling place multiple times. So check your polling place, check your districts, check your ballots in advance. You never want to be surprised walking in there, even though I feel like I always am, even though I try to do practice ballots the days before, and get active and see who's on there and ask questions in advance. It is, I think, difficult to find out a ton from candidates' websites because they reasonably so work to be sort of vaguey there. But usually candidates are more than willing to answer your questions if you reach out to them. So reach out to candidates and get involved. That's the last of that on the slide that I wasn't confident was me, but I definitely am now, and I like it. And now it is Dustin, and I am out, and you are free. So I'll just be chatting it up in the chat. Thanks, y'all.
So we do this every time we come on here because when it comes to food assistance or housing assistance or medical assistance or sort of federal relief, all of these things are happening in an economic context. And we always think it's helpful to just sort of give folks a snapshot of where things are right now, and what the needs are that continue to exist in our Commonwealth. So this is a slide I've been showing for a little while now, and I plan to continue showing it until we recover fully, at least, to a pre-pandemic level. But, despite a lot of the rhetoric that you hear on the news or, from other folks, we are actually in the midst of a historically strong recovery when it comes to jobs. We have had despite the lowest drop in jobs in our state's history, we've recovered faster than the last 3 recessions. And that little yellow line is the current recovery. We're set to outpace the recession to 2007 as well as 2001. And I left the 1991 recession on there just to show you how small it was, even though we still, talk about that in our textbooks. So up till this point, we have recovered 276,000 of the jobs that we lost in 2020, which is almost 94% of the way back to February of 2020, which is the pre-pandemic level. So we're actually moving very quickly, and I anticipate in the next couple of months we will see our jobs back to pre-pandemic levels. That's been especially true for trade, transportation, and warehousing. So think of like your Walmart and Amazon warehouses and transportation, but it's been true for a couple other industries as well. So we, just to add that folks are going back to work very quickly. And I don't know if anybody saw the news today, the job openings, leavers and turnover survey, the JOLT survey, came out and showed that we had another record high number of quits last month. And again, I just want to point out that those quits are not people leaving the workforce. Those are people who quit their jobs and take another job. So we remain on net positive for job growth. And what that points to is that folks are leaving jobs and they're going into positions that pay better, that are a better fit, that have better flexibility or better benefits. And so it's been really beneficial. I see a question here in the chat, about wages and benefits for those jobs. So, it is a mixed bag a lot of times, but generally speaking, wages have been growing. They've been growing along with inflation. So there's some concern about different income levels, about whether or not that's actually a real wage growth versus a sort of wage growth that's being eaten up by, really rapid inflation, which is being fueled by supply chain shortages, by what's happening in Ukraine, and largely those two things. There's some consideration about a year ago that some of the stimulus money was moving that, but that money is pretty much gone at this point. So there is I think generally speaking, an improvement in wages, but there's not super clear data yet on how across the board that is. So let's move on to the next page. One thing we can say, though, is that net wealth, which is basically just how much do you have in either equity in your home or in your savings account versus how much debt do you have, has been growing. And it's been growing really across the board. So a lot of that has to do with federal relief. A lot of that has to do with paying down debt. For wealthier people, that has a lot to do with a really strong performance in the stock market. But generally speaking, it's been positive across the board. So this chart over here shows different income levels, net wealth growth over time. And as you might imagine, the wealthier you are, the more your income, or the more that your total wealth has grown. But what's different about this pandemic, as opposed to, the recovery from the Great Recession, is that low income wealth has grown too. So the lowest income group's wealth has grown by 13,000, which is important. The economic stabilization measures that we deployed during the worst part of the downturn, like boosted unemployment benefits, like stimulus checks, like boosted SNAP benefits, they all had a really strong impact on people's well-being overall. If you're well off, though, this was a real gangbusters couple of years for you. The highest income group's net wealth grew by over $500,000. So, we still have income inequality. That income inequality is growing. I'm sorry, wealth inequality specifically. But it is good to see that low income net wealth is going in the right direction. Let's go to the next slide. Another thing I just wanted to point out is unemployment insurance claims. This is a really good way of getting sort of weekly, quick hit snapshots of where things are. A reminder, you only get unemployment insurance in Kentucky right now if you are laid off from your job. You can't quit and claim it. You can't just walk off the job. You can't have already been unemployed and file it. You actually have to have a pretty substantial work history over the last year and a half. And then your employer has to let you go through no fault of your own. You can't even be fired and get unemployment insurance. So what you see here is that during the first several months of the pandemic, there was a massive swell in claims, and then it really fell off. You see a couple really tall bars there at the beginning of this year. That was when we were making up for claims that were owed from previously in the pandemic that never got paid out. But if you look at, just a change in where we were pre-pandemic and where we are now, we are below pre-pandemic levels for unemployment insurance. So if you look at the last week of February, which is sort of the last week before the coronavirus hit Kentucky, there were about 2,200 continued claimants. These are folks who are taking out more than one check. As of April 9th, there were only 1,700. If you look at, those are initial claims. If you look at continued claims, there were 23,000. Right now, there are only 8,600. So, we are really looking at a remarkable recovery. Layoffs are incredibly low. Quits are high because people are taking better positions and net wealth is growing. Now, I know I mentioned earlier, inflation is becoming more of a problem for folks who are trying to afford gas, trying to afford food. The next round of inflation data will be out on the 11th. And at that point, we'll have a little more to say about where those things stand. So I see a question here in the chat. I will answer that in the chat, but for time, I will go ahead and hand it over to the next presenter.
All right. So this is Adrienne Bush with the Homeless and Housing Coalition of Kentucky. Glad to be with you this afternoon. We generally talk about housing assistance in a couple of different buckets. So the first part I wanted to discuss was homeless assistance. There's some interesting information that just got published that we're going to get to. But many of you are familiar with the point-in-time count process. This is a count that happens annually in January, usually. And so it's a helpful tool if you're looking at trend lines over a given period of time. In Kentucky, I generally start looking at about 2013 on. The methodology hasn't changed too much since that time. But it is helpful in understanding if the number of folks experiencing literal homelessness, people who are unsheltered or on the streets. It's also helpful in understanding that it is not an urban phenomenon only. You can see on the pie chart on the right, over a quarter of our folks are in Louisville, a little bit under a quarter we're in Lexington, and then the rest are in what we call the balance of state, the other 118 counties. Next slide. Okay, and point time count data is helpful, but it's a good starting place. So I was really excited to see some research published in HUD's Cityscape magazine from a researcher at Southern Illinois University at Edwardsville, and then a research assistant at the University of Kentucky that talks about changes in Kentucky shelters and unsheltered homelessness over a 5-year period. And you may ask, why are we looking at data that ends in 2020? And that's because homeless and housing data generally lags behind. Unfortunately, we don't have weekly or monthly or job or quarterly job reports, the equivalent thereof. And so you can see when I present on homeless resources and where to get assistance, kind of why it's what I call a patchwork of systems, of crisis response systems. So you can see here where the decline in shelters have happened, where the increases in shelters or other housing permanent housing programs have occurred. And then really this map helps explain while there is some migration between counties, it is not, sometimes people will get the impression, oh, if we build a homeless shelter, everyone will just show up here. And that the data does not indicate that. Generally speaking, communities with more resources have the ability to provide shelter. And also that is where people just happen to be, right? The other thing too that I wanted to point out is that if you look at, I tend to look at overall numbers for the state. I did not realize until this month that Kentucky is it's the only state in the country that actually provides county by county data. And that's part of why it takes us a while to release that information. 2021, we did just a sheltered count because of pandemic conditions. And then we're waiting on 22 data. The count just happened in February, again, because of pandemic conditions. Next slide. Okay, so we also talk about rental assistance to help keep people housed, make landlords whole, keep everybody where they are. But right now, there are some differences among the 3 major programs. In Louisville, the Emergency Rental Assistance Program has closed to new applications because they have spent and or obligated all of the money that was allotted them to Treasury and reallocated from the state. Leaders in Louisville are asking the state to allow applicants in Jefferson County to apply directly to the state's program. So that advocacy is taking place. Lexington's program continues. They have given out about $24 million so far. They anticipate that their program will continue the rest of the year. And then the rest of Kentucky can go to teamkyhherf.ky.gov, Healthy at Home Eviction Relief Fund. Next slide. Okay. So this chart gets into kind of the patterns month over month spending. Some months are higher. We hit our high point in October of 2021. That was generally when the state was able to catch up with some backlogged cases and get everything processed. So it's gone down since then overall. But you can see the amount of money that has been subgranted to Louisville and Lexington, as well as voluntarily reallocated, as well as how much has been paid in assistance for rent, utilities, and internet. And at this point, about 33 million in ERA 1, which was the federal name of the program, remains available to assist Kentucky renters. The General Assembly did include emergency rental assistance as a pass-through in House Bill 1, the Free Conference Committee report. And so there is ERA 2 on the way. So we anticipate that this program, at least at the state level, will continue. Next slide. Another thing that we look at is the number of applications paid disaggregated by race and ethnicity. As we know, this pandemic has not hit socioeconomic and racial categories of people evenly, if you will. And we know that there's a significant difference in the number of white Kentuckians who own their homes or have a mortgage versus Black Kentuckians who have a mortgage. And therefore, that means more Black Kentuckians are renting as compared to the general population. In Kentucky, we know that while the majority of folks who are receiving assistance are white, the next biggest category are Black or African American. Next slide. Okay. And just reiterating, there is assistance for people who hold mortgages and they have fallen behind through no fault of their own. The Housing Assistance Fund. It is operated by Kentucky Housing Corporation. This is a screenshot of the Kentucky Homeownership Protection Center. Next slide. And it does cover all 120 counties. And the eligibility is basically that there's $85 million to help homeowners. They can receive up to $35,000 in assistance with all of these things: mortgage bills, utilities, insurance premiums, property taxes, and HOA fees. And the funds will be available until fully expended or September 30th of 2025. All right, next slide. Okay, I'll turn it over to Tyler.
Hey, thanks, Adrienne. My name is Tyler Offerman. I work with the Kentucky Equal Justice Center, mostly on public benefits programs. So we'll talk a little bit about some of the nutrition assistance programs, impacts from the General Assembly, and just some other general updates. So every month start off this section with the slide on SNAP participation, just to give folks a temperature check of where we are and where we've been. Dustin did a really good job of talking about, past recessions, recoveries. You'll see that last recession, which unfortunately wasn't that long ago, you can see the buildup and then the wind down starting in 2008 to 2016. Those weird little wobbles between 2016 and 2018 were policy changes by the Matt Bevin administration that made it harder to access SNAP. And then the big sort of up plateau and down is the beginning of the pandemic. So, it's important to always remember that SNAP is meant to grow enrollment during times of economic crisis. That's one of the main functions of the program. So we can see it has been successful in doing so. Obviously, we see a slight uptick here in the past 6 to 9 months, and that is something to keep in context with the sort of broader strokes that we are seeing a big economic recovery, but there are acute areas of the Commonwealth that are still not at all back at full employment and do not have a lot of opportunities for folks. So program's working as it is and should. You can go to the next slide. Cool. Just to elaborate a little bit more, the darker this map, the higher SNAP participation. If I had another map that showed unemployment rates, it would be very similar. Just got a couple facts over there on the side. Important to remember that SNAP, along with being a critical safety net to make sure literally people who are struggling don't starve and that their families and children don't starve. But in addition, it is a massive economic driver for a lot of farmers and grocery stores. Well over $1 billion every year come from SNAP into local economies. I'm not the economist, so I won't get into the multiplier effect, but definitely a positive impact while helping critical populations. And just a little bit as far as sort of year-to-date numbers, and 132, almost $133 million just in March. So cool. Now let's dig into some of the meat and potatoes, tempeh and potatoes, if you're a vegan, of what happened during this General Assembly around nutrition assistance. So one thing of note, I've gotten a lot of questions. I know a lot of our organizations have. The SNAP emergency allotments, max allotments. So during the during the pandemic, Congress passed a law that said if the state has a state of emergency and the federal government has a state of emergency, both at the same time, then as long as you are eligible for SNAP based on your income, you would get the maximum benefit allowable. So, this is really important for, let's say, I've worked a lot with seniors, right? They do not have a lot of income. Well, they're not working, I should say, but they have some SSI and other things. So maybe they got $15 a month to help them, meet their nutrition needs. So this would take them up to the full amount while this is in effect. Anyways, with the action of the General Assembly to prematurely end that state of emergency with Senate Joint Resolution 150, it basically set off a series of dominoes, which meant April was our last month for emergency allotments. And those, as of the beginning of this month, are going to revert back to the old sliding scale based on income. About 42% of the SNAP benefits coming into local economies were from emergency allotments. And it's particularly upsetting, disappointing that this was done in full awareness that these SNAP benefits would end, even though there weren't any other emergency orders in place, because the federal government just extended their state of emergency. So instead of just us missing out on $50 million going into local economies, it's more like 150. So yeah, and then great point. This is all while massive spikes in food prices, double digit, sometimes up to 25, 50% for some really important things. So really upsetting, really disappointing, and it is done. So next slide. One thing I wanted to make sure to lift up here is that during the pandemic, because of emergency allotments, I think both participants, but also workers maybe lost some of their I was going to say muscle tone, but basically, our remembering that there are a number of deductions in SNAP that, make sure that participants get the maximum amount of benefits allowable to them. So with, the past 2 years, folks just not getting used to or sort of forgetting some of those, I just wanted to go over those just in case. So all of these are deductions that can be applied to your SNAP case. Obviously there's massive amounts of variation as far as what does that mean for your individual case, but if you're not sure, you should call the cabinet and you should just update your case file to make sure that these are all up to date. So shelter costs, utilities, these are just like we were talking about it with inflation, for sure, things that have changed over the past 2 years. But also do want to lift up the medical expense deduction. I know in coming months, we'll have an update on this one. because House Bill 7 did tweak the medical expense deduction a little bit. So as soon as the cabinet implements that change, we'll certainly bring that information to y'all. But as you can see, if you are a senior or have a qualified disability, there's a lot of stuff, medical expenses you can make sure to deduct. So if you have any questions, feel free and reach out to me or your local legal aid on that. But okay, next slide. PBT. It's the thing we love to talk about and don't always have answers to. But PBT, as y'all know, many of you know, unless you missed it, the PBT for school age kids plan has been approved. The cabinet is implementing that actively. The timeline there at the bottom lays out the information as far as we know right now. So May 25th, there will be a big disbursement of PBT. That is later this month. So make sure there'll be more information later in the slide. If you lost your card, get it. If you changed your address, update it. Ideally, you could do all those things before May 25th. So that way, you don't have to futz around trying to figure it out on the back end. So just a couple things of note. Kids that are not included in the PBT plan, kids in daycare, homeschool, full year virtual programs, virtual academies, or 2022 graduates. We've got a couple frequently asked questions, but we've definitely got a lot about this virtual academy. And unfortunately, the state did not really have flexibility here. USDA said, the way the law is written, the absences have to be basically unplanned, right? Like your child had to be quarantined, the school had to close. So voluntarily putting children into a virtual academy that was not dictated by the pandemic. I know that that's a really slippery slope, but unfortunately that's where we're at. So I think we're all pretty familiar with the timeline. Kids have to be in free and reduced lunch, 5 or more consecutive days. But there is a reconsideration process, which we talk a little bit about there. But you can go to the next slide. Just a little bit more on that. There's those numbers for replacements and reconsiderations. And 5 consecutive days is the way that they define it. So that first tranche in May 25th and that later one, not including the reconsiderations, just the proactive. This is the data we as the cabinet have been sent by the schools. They use that 5+ consecutive days. But individual absences do count. You would just have to call to do a reconsideration. I know we missed these 5-day blocks, but there was this one 3-day quarantine. They told us to send him home. He got exposed, but then he came back negative. So it's not 5 days, but those 3 days do count. Great. Oh, also one other thing on reconsideration, they're not going to accept calls until June 1st. So there will be the May 25th disbursement. There's a week, and then you can start to do reconsideration. Okay, next slide. Just a couple frequently asked questions. This is not an exhaustive list, but a couple things that have come up. So mentioned, school closures a little bit, but again, individual student absences do count. Probably just have to do it through reconsideration. How much does each child get? That's not the same way that previous PBT plans have rolled out because they are allowing for those individual days. So I don't have a hard number, and it'll really depend on your individual situation and school district. Next one, child began school this year. What do I need to do? Nothing, hopefully. It should all go smoothly. You shouldn't have to register or anything like that. Again, just like everyone else, though, if you think you got less benefits than you should have, call for reconsideration. And that last point, and this is, especially important because of the ending of the SNAP emergency allotments, but, food prices are skyrocketing, and, with SNAP benefits getting cut, with PBT, coming, but not as quickly as many of us would like, and then prices skyrocketing. Here's a couple other just opportunities to try and get some more nutrition assistance. And if you have any questions about needs, please do reach out to me, anyone in this group. But here's some places to start. And then coming soonish, I did the spinny animation. I always feel like such an old man whenever I do one of those animations, but you know, here we are. So the good news on PBT is that there are, I mentioned that kids under 5 in childcare centers whose families are on SNAP in the past got PBT. It wasn't included in the school age kid plan, but good news, the state, it was a USDA thing. They didn't give guidance on the childcare piece, but they did on the state or the school age kids. So the state just went ahead with that one and is basically waiting. Well, it's working now on the childcare PBT plan that'll get submitted. And any child that receives PBT through the school age PBT plan or the childcare PBT plan will also get summer EBT. I severely doubt that either of these will happen during the summer. I think there's a chance that childcare PBT might get submitted and finalized and all that before the next school year starts. I would put summer EBT more at like hopefully before the end of the year. So think about it as late fall EBT. But obviously, as we get more information, we will share that here. And then I think I saw, can you show the screen where to call to get a card reissued? We're going to send all these out as far as I understand it. So you'll definitely have that information. But okay, great. All right, and then I think that's it. So I will hand it off to Priscilla. Thank you.
Thanks, Tyler. Hi, everyone. I'm Priscilla Easterling, the Outreach Coordinator for Kentucky Voices for Health, and I'll be doing our health updates today. Next slide, please. All right, so just a reminder, since last we met, the public health state of emergency was renewed on April 16th and will last through 90 days through July 16th. The Biden administration did promise to give states a 60 days heads up if they plan to end the PHE. So that's actually around May 15th. So we should know around then whether or not it will be extended again. For Medicaid, a couple of updates. Effective July 1st, prior authorization requirements for SUD residential and inpatient treatment services will be reinstated. So that means you or your client needs to get approval before seeking SUD residential or inpatient treatment. For Medicaid renewals, they will begin again at the end of the PHE. The state will start doing them again. So make sure that your contact information is updated in your Connect account. And if you have any problems doing that, you can reach out to Connectors for help and they can do that for you. And MCOs will also send out letters to members to notify them of upcoming renewal. The state will also send out letters to notify members of upcoming renewal. So if you have any problems with that or any questions, just reach out to Connector, they can help you. And then just a reminder, SB 55, which was passed last year, permanently prohibited any form of cost sharing, including copays and Medicaid. So we've heard a couple of reports in the last month or so about people having copays, either seeking services or medication. There should not be any copays with Medicaid. So if you have any problems with that, please reach out to us and let us know so that we can make sure that no one is charging copays within Medicaid because it's not allowed. And then as always, for all insurers, there are no out-of-pocket costs for COVID-19 vaccines, whether you're insured or uninsured. So if you still haven't gotten your vaccine, go get one. COVID is still real. So, and if you need any help with any of that, there's a vaccine appointment checklist and they can help schedule that appointment for you as well. Next slide, please. Okay, PE. So currently PE is still a thing. We allow 2 PE periods within the calendar year, and that's the month of your application and the following month. You can apply for PE anytime throughout the year if you're uninsured, under 65, and if your income is at or below 138% of the federal poverty line. It's managed by United Healthcare. And right now there are only about 2,000 to 3,000 Kentuckians who are currently covered by PE. It is still currently available at the public site that is linked here. HB7 did make some changes, so that won't be available much longer, but at this time it is. So if you need PE or if you know anyone who does, please use this link and get yourself covered. Next slide, please. Okay, Medicaid and K-CHIP are always open for enrollment. The open enrollment period for Medicaid and K-CHIP is specifically for people who are already enrolled in Medicaid to change their MCOs. If you need to enroll in Medicaid at any point throughout the year, you can do that. You don't have to wait for an open enrollment period or anything like that. If you're, again, under 65, your income's at or below 138%, you can apply at any point, and you can do that on connect.ky.gov. That the recently does not cover, yes. So the recently issued prior authorization memo that'll start July 1st does not cover targeted case management services. Those are two separate issues. This is just for residential and inpatient treatment, but it does not cover targeted case management services. Thanks, Adrian. For marketplace coverage, open enrollment does, that is based on an open enrollment period or a special enrollment period. Open enrollment begins November 1st for 2023 coverage. But if, in the meantime, if you have any life changes or in any exceptional circumstances or a third new SEP that's getting ready, that is already in effect, you can go to connect.ky.gov, apply for an SEP, shop and compare plans at any point. And that's the great part about it being a one-stop shop. You can apply and just see what you're eligible for. And again, if you have any problems, any questions, if you're not sure, you can always find a connector, and we're happy to help walk you through the application and walk you through any questions you might have. Next slide. Okay, here are the currently, the 2022 current available MCOs with side by side of their extra benefits. More details are available at all of these links. Next slide. And then here are the current qualified health plans that are available on Connect, Anthem, CareSource, and Molina, and WellCare. Most areas have 4, several areas have 4, several areas have 2 or 3, and only a handful of counties only have 1 of these available. Next slide. Right. And so the enhanced subsidies from the American Rescue Plan are still in effect. They run through the end of 2022. So if you have not gotten a chance to go and Connect and check them out, if you haven't had a chance to shop and just see what's available, I recommend you do that now. With the enhanced subsidies, the prices of plans are much cheaper and much more affordable than they have ever been before. So definitely worth checking out before the end of this year. Next slide. Okay, so a little bit more about the special enrollment periods. There are 3 different types. They break down into 3 different groups. So the main special enrollment period are based on qualifying life events. So that's like getting married, having a baby, losing your coverage, any other moving out of the state or moving into the state, losing your employer coverage, stuff like that. Those are what we call life changes. And you can apply for those on connect.ky.gov, but you may be asked for documents to confirm information like if you got married, a marriage certificate or birth certificate, stuff like that. And just a reminder that failure to pay premiums does not qualify for a special enrollment period. So if you lost your coverage because you didn't pay a premium or because your client didn't pay a premium, that does not qualify as a special enrollment period. But all the other life events do. Next slide. There are also the second type are exceptional special enrollment. So these are based on exceptional circumstances other than traditional qualifying life events. So examples of that are being incapacitated, being affected by a natural disaster, experiencing domestic abuse or violence, experiencing spousal abandonment. This is a totally different kind of enrollment period with a special enrollment period outside of those SEP ones. And you can apply for those. Kelly, next slide, please. You can apply for those, or a connector can apply for those on your behalf by submitting a statement to request the exceptional special enrollment, either by email or letter. You should include your first and last name, case number, agent, connector, why you're requesting this, and then details about the desired plan if you've chosen one, start date, and then contact information. And you can do that by emailing that connectesc@ky.gov or by standard mail to KHB. Next slide. And so the newest SEP that's now available, it's not available on Connect yet. It should be next month in June. But right now, it's you can request this by going to requesting it directly from KHBE from their program inbox. So this SEP was available originally on healthcare.gov last year and was available beginning in March. But now it will be available on Connect now too. So this is for people who are eligible for the APTC and have a projected income at or below 150% of the federal poverty line. So now, if that applies to you or one of your clients, they're eligible to enroll in the federal marketplace at any time, any month during the year without having to experience a qualifying life event. So that if your income is at that 150%, you don't have to have gotten married or moved or anything like that. Just because your income is at 150% or below, you can access a qualified health plan at any point throughout the year. Right now, this is a temporary SEP. It's only available for the rest of the year, but right now, that's still a really great deal. And CBPP estimates that around 7,000 Kentuckians will qualify for this SEP. So it's really cool. And right now, again, it's not available on Connect. It should be next month. But in the meantime, you can enroll by contacting KHBE, their program inbox at that email. And for more information, you can check out this fact sheet from Health Reform Beyond the Basics. Next slide, please. And then the proposed rule to fix the family glitch. So the family glitch has been a problem since its inception. Since the ACA started, it has continuously been a problem. Basically, the marketplace determines eligibility for those tax credits, that piece that makes your QHP affordable, by comparing the cost of the insurance and the family's income. But they set the affordability threshold by using the employee's self-only coverage, the cost to just cover the employee. And they say if it's more than 9.83% for the employee only, then it's considered unaffordable. But if it's less than that, then it's considered affordable. But what it doesn't do is take into account the actual cost to cover the rest of the family. So everyone knows if you've ever had employer-sponsored coverage, to add your spouse or other dependents, those plans start to balloon. In fact, the average self-only health insurance plan averages around $7,700 a year, but for a family, it's $22,000. And right now, the way that the family glitch works, they only look at that $7,700 and say, hey, it's considered affordable, and ignore that $22,000 number. So what they're proposing right now, next slide, please. They're proposing a separate test. So they'll look at the affordability for the employee only. They'll look at the affordability to add one person, two people, three people, and then on. And base the affordability number and whether or not you're eligible for tax credits, if it's more than 9.83% for employee or employee plus dependent, employee per spouse, employee, all of that. They do separate tests so that they can really look at what the cost of a family coverage plan is through an employer versus through the marketplace. They also will include an official definition of what minimum value that includes substantial coverage, because right now some employers are able to sort of skate by and make an offer that is not technically a substantial coverage, but they can check off the box and say that it does. So they will include a formal definition of what minimum value is. So this should apply to 2023 coverage beginning with open enrollment this November. And it would extend coverage to around 200,000 uninsured people, reduce premiums for around 1 million people already enrolled in a QHP without those tax credits. And they estimate that around 5 million families nationwide are affected by the family glitch. So they're currently asking for public comments on the public comments on the family glitch and the fix. Those will be due June 6th. Stay tuned. We will send out more information for how to submit your comments. If you have more questions or want more information about the family glitch and this fix, check out this fact sheet from Biden-Harris administration. I agree. It is such a stupid rule. The interpretation has hurt so many people. It makes no sense that that's how they've been evaluating it. I definitely agree, Jessica. But this is a great time to submit comment and talk about how the family glitch has impacted you and how changing it, how fixing it would really help you and help others. So definitely submit a comment if you have strong opinions. So finally, the new proposed rule for Medicare SEPs. So they are proposing a whole list of new SEPs, and those would be for Medicare specifically, so that you don't have to wait for the general enrollment period or GEP without having and be able to enroll outside of your initial enrollment period without having a late enrollment penalty. A lot of tongue twister right there. So some of these SEPs, it would be for individuals impacted by an emergency or disaster, SEP for health plan or employer error. So situations where an individual can demonstrate that their employer or health plan materially misrepresented information or hindered them from enrolling in Medicare in a timely manner. SEP for formerly incarcerated individuals, SEP to coordinate with termination of Medicaid coverage. This is a big one because we've heard a lot of reports of people who have stayed on Medicaid coverage throughout the pandemic and missed their initial enrollment period for Medicare. And now we're looking at it and are looking at having to pay a late enrollment penalty. And those are permanent. That's not just like a one-time fee. It is a permanent fee moving forward. So these new SEPs would allow for those people and for people in those boats to be able to access this coverage without having to pay that late enrollment penalty for literally the rest of their lives. So really awesome. And then the final one would be an SEP for other exceptional circumstances. So just if something major came up, that would be case-by-case basis. These are all proposals. And they would expand Medicare enrollment opportunities. If you'd like some more information, check out the CMS fact sheet that I linked below. And that should be it. All right, turning it over to Adrienne.
All right, I'm back. I am filling in for Marcy Timmerman with Mental Health America, Kentucky. Next slide. All right, so May is Mental Health Month. There was a celebration and luncheon today, kicking it off. And MHA Kentucky has a number of events slated to increase mental health understanding and treatment. You can check out their entire slate of events and the National MHA Toolkit at the link on your screen. Next slide. All right. Marcy would like everyone to wear green for Mental Health Day, which is next Friday, May 13th, 2022. And you can share with us on social with the hashtag MHAKY. This has been going on since 2019, and it's the second Friday in May. You can join us by wearing green, host a Wear Green Day at your workplace, and tell people about Mental Health Month. It shows solidarity and encourages people to stop discrimination against people with mental illness. You'll be breaking down barriers and looking lucky on Friday the 13th. Next slide. Okay, so Marcy is our mental health first aid expert here at Thrive Kentucky. It's a class that teaches you how to identify mental health issues at the early warning and crisis stage. if you take these trainings, you'll see the links are live when Kelly sends those out with the schedules. You'll walk away feeling more comfortable having potentially awkward conversations and with a better understanding of mental health issues. The adult course is for those 18 and over, and the youth is for adults working with youth ages 12 to 18. So it's more developmentally appropriate. Next slide. Okay. So their MHA is good at promoting mental health screenings. Again, this link will be live. They're free, anonymous, and will link you to other resources. And she's got the total screenings taken the first quarter of this year, as well as a total of almost 24,000 in 2021. What the data is indicating right now is increase in anxiety and depression, which is not surprising given the world events right now. And then loneliness, past trauma, and relationships are cited most frequently as reasons people are taking screenings. Mental health is available. You can see the graphics here. We've got the National Suicide Prevention Lifeline, as well as the crisis text line, where you can text hello to 741-741 and get help with the Trevor projects. You can call the crisis line at your local community mental health center for services, or you can call the suicide prevention helpline for immediate counseling, and help is available, especially through telehealth. Just want to give a shout out to Marcy's work on Representative Banta's 988 bill. We hope, while there is some funding with HB1, we hope that the General Assembly will take the interim to look at what it means to, what it would take to really implement this well in a sustainable way. And with that, I will turn it back to Emily Beauregard to talk about resources for advocates and consumers.
Thanks, Adrienne. We can go to the next slide. So I'm not going to go through all of these slides. These are slides that we include at the end of every presentation, and we just add new resources and materials as we have them and try to keep them current. But there are two slides that I want to go through. This one in particular, I don't think enough people are aware that you can get free COVID tests through Medicaid, but that's actually true. But this slide is about Medicare. I talk about Medicaid too much. So people with Medicare Part B and Medicare Advantage can access free tests, and this is the information that they can follow in order to get those tests. So you can go to your pharmacy or a healthcare provider who participates in this initiative, and there's more information at the link there, medicare.gov/Medicare coronavirus. And there's some FAQs that you can access. So please share that information with your community and encourage people to continue getting tests and testing, even though we know that many people have had COVID and many people have gotten their vaccines. But we will continue to see new surges. We will continue to see new variants, and testing never hurts. So people should stock up and take advantage of this. And we should provide more information about the options through Medicaid as well, which we'll do next time. Let's go to the next slide. We'll actually just go to the end where we have information about our upcoming meetings. So all of this information is great information to have, but information that we've gone over before. So here I wanted to just bring your attention to some changes in our schedule. I mentioned at the beginning of this call that we are going to be hitting the road, and actually for the first time in over 2 years, we'll be in person in many communities around Kentucky, which is super exciting for us. We've missed that. We will be doing our Thrive Kentucky Roadshow in every ad district, the area development districts. There are 15 altogether. And so I'm going to show you those locations in just a minute. But that means that some of our monthly updates that we typically do the first Tuesday, instead we'll be on the road doing a very similar update, but also with some additional information and more on civic engagement and advocacy. And those will be almost every Tuesday. So those dates and the exact locations and registration is all forthcoming, but just wanted to make sure people knew that we're changing things up a little bit. We will still have our December 6th webinar. We won't be on the road then. And then as far as forums with the Cabinet for Health and Family Services, our next one will be June 28th. And then we will probably reschedule the November forum because we'll be on the road for November 1st. So just wanted to make sure everybody had that information. Let's go to the next slide. And then here is the list of ad districts. These aren't the exact locations, but the dates and the ad districts that we're going to be visiting on our roadshow. And we'll be covering a lot of the same topics that we talk about on these monthly updates, but we'll be adding in childcare, transportation, public health, and civic engagement. And so we'll have some additional information about those programs, about things like vaccinations and access. Transportation, we know, is particularly a barrier to healthcare and lots of other services. And then civic engagement in terms of voting and also the differences between education, advocacy, lobbying, those sorts of things. And we will also be following that with a listening session, which I will tell you more about at a later date. But just wanted to make sure people knew that this was coming. Just keep an eye out for more information. We're planning for these sessions to start around 10 a.m. in the morning and last for about 2 hours. We'll provide lunch, and then people will be invited to stay for the listening session if they'd like to. So watch for that information. We can go to the next slide, Kelly. Just a reminder that if you are a licensed social worker or a certified community health worker and you want CEU credit for today, email Kelly. And like I said, for the roadshow, we're actually going to have more CEs for more professionals available. So that's exciting. There will be a session in Louisville, Bev. Yes. And we'll try to get those locations out pretty soon. We're just working on firming up a few more. And we'll have a flyer, we'll have an agenda, we'll have lots more information. So I would say in the next couple of weeks. Let's go to the next slide. Oh, and continue. This is all of our contact information. I thought that we might have one more slide. I'm thanking our sponsors again, we might not, but I wanted to say thank you again to our sponsors. And again, invite other organizations to sponsor our work and our roadshow if you're interested. And with that, I just want to thank everyone for joining us. We are ending 2 minutes early, which is really good for us because, as you know, we like to push it until the very end almost every time. And we will have more information out soon, but we'll plan to see everyone on June 28th for that forum with the Cabinet for Health and Family Services. Thanks again. Have a good afternoon.